everybody. I just wanted to come in this afternoon and talk to you a little bit about chiropractic, what kind of chiropractic we do here in the office, how it works. Okay. Sorry, my cameraman is unsure. We wanted to let you know how chiropractic works, what it's good for, the kind of chiropractic that I do here in the office, and just how that relates to your overall health in general, okay? So as you can see here, the quote behind me says, "The doctor of the future will give no medicine, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease." And that was attributed to Thomas Edison. So really the approach that we have here in the office is exactly this. So we want your human frame, that would be your spine, your bones, everything connected to it, including in particular the nervous system, so your brain and your spinal cord as they run down through the spine and out into the extremities. So we care about the integrity of that, the balance of that, making sure that it's well aligned and that there's no nerve interference. That is the basis of chiropractic and what we're trying to accomplish. By doing that, we can eliminate pain and we can improve function and range of motion. But the real underlying thing that we're trying to handle is actually fixing the nervous system, balancing the nervous system. The other thing that we care about is diet and the cause and prevention of disease. So the idea is that we really want to be able to feed the body what it needs in order to balance out your organ function, prevent illnesses, prevent bacteria and viruses and things like that from taking hold, improve function of your digestive system, you name it. Those are all things that we like to do here through diet and also through supplementation. So I know you can't read the details on this poster, but I can tell you that what it says here is supporting healthy connections. So this is a picture of the spine. This is telling us the different areas that might be affected when different parts of the spine are out of balance. So for instance, C1, which is the top top bone in your neck, it says here that it is related to the brain and the vagus nerve. And the vagus nerve is a big, thick nerve. It's thickest on the left side. There's one on each side. They come down and they innervate your heart, your stomach, your digestive system, so, and many other things. So if the vagus nerve or the brain is being impacted negatively, we want to look at making sure that area is well fed, but we're also interested in making sure that the top part of your neck is aligned properly. If it's not, you can get things like headaches, erratic heartbeat, upset stomach, even reflux, issues like that, burping, high blood pressure, low blood pressure, any kind of digestive complaint you can think of. Those are all potentially linked in to C1 being out of alignment. So we would be checking to see, is your spine properly aligned, but then also are there any nutritional elements that are missing that's keeping that area from healing. So sometimes we do just the nutrition, sometimes we do just chiropractic, sometimes we do them together. So listed here are the different standard products that we might use for that area, supporting those nerves. So it lists things like neurotrophin, neuroplex, cataplex G. These are all things that some of you might find familiar. So those types of products can support the nerves, support the brain, and actually support healing in the upper part of the neck. So again, what we're trying to do here in the office is determine the underlying issue, what needs to be addressed, and how to correct it. So we'll do a combination of things using either chiropractic or nutrition to bring balance back to the body. This poster is in the office, it's in my treatment room. So if you ever want to look at it and correlate the different areas and issues that you might be having, we can always show this to you as well. So this is called an activator. So for chiropractic care, I'm trained traditionally as a chiropractor, so I can do manual adjustments, but the major way that I help my patients with chiropractic is using an activator. So Activator Methods is a specific form or method of chiropractic. It's non-invasive, it's very safe, it's low impact, and it's very comfortable. So people who are not comfortable with getting cracked, is what they usually say, if they're not comfortable with that, if they have weak bones or frail bones, or if it's hard for them to twist and turn, then Activator is a great way to, a great approach to use for them. But I also use it for many people who typically have experienced traditional chiropractic and they really like it as well. So one of the things that we do, we have you lay on your stomach on a special table, and then the activator has different settings. So we use a lighter setting for your neck, because it's not as much padding up here, so it's a little uncomfortable to use a higher impact. And then for your lower back and pelvis, we would use a higher setting. It's got a little rubber tip, so when I find the area that needs to be realigned in order to improve the muscles, the bones, the nerve function in that area, I'll just push this onto the area and click. It makes a noise and there's just a little impact. So again, it's very comfortable, it's very safe, very low intensity, but it does a great job of realigning the spine, realigning extremity bones. I can adjust elbows, fingers, feet. I do that all day long. So by doing that, we're going to maximize the nerve function in your spine and in your body, and we're also going to be addressing any organ areas that might correlate to those levels. So for instance, if you are having trouble in the middle of your thoracic spine here, sometimes that will correlate with a lung problem or a stomach problem. So sometimes we'll find that correlation as well. So if we're working on your stomach, we might also find that you need to be adjusted in the middle part of your back. So I just wanted to give you that rundown, give you an idea of how we utilize chiropractic, what it's all about, why it's an important part of your healthcare. So I adjust people from literally days old all the way up into their 90s and everybody in between. Everyone can benefit from chiropractic when indicated. So if you have questions about it, please put them in the comments, or you can certainly call the office and we're happy to talk with you. Hope you have a great day.